Dear colleagues, thank you for sharing with me the data connecting the development of structural changes in patients treated for hep C in the Czech Republic. Gradual introduction of new anti-HCV drugs had changed the structure of treated patients from various points of view. From the point of view of age, stage of liver fibrosis, spectrum of individual HCV genotypes, or choice of treatment strategy. These aspects differ in individual countries. The aim was to find gradual structural changes in patients treated for hep C in the Czech Republic. In our country, treatment of hep C is provided in design centers. Since 2016, 17 of these centers share elected data from HCV-treated patients in harm registry, which was the source of data presented here. The registry is strictly anonymous. Since 2016 till 2019, in 2,151 patients, anti-HCV therapy was introduced. In this graph are number of patients treated in individual years. Mean age was 48.8, 57 of treated patients were men, and 3% of treated patients were HIV positive. Here are all centers sharing data in harm registry, arranged according the number of treated patients. If we have a look at structural changes in age, we can see that gradually patients treated for hep C were younger. In 2016, the mean age was 52, and in 2019, 44.7. Patients younger than 50 were 40% in the first year of follow-up and 70% in the last year. If we have a look on structural changes according to stage of liver disease, patients with more advance of liver fibrosis were 51% in the first year of follow-up and 25% in the last year. The most prevalent HCV genotype was 1b, but we can see gradual growth of percentage of so-called newer genotypes 1a and 3. The most commonly used drugs the first year of follow-up was 3D and still interferon-based regimens. In 2016, the second year 3D, the third year grazoprevir lebasvir, and last year lecaprevir pibrentasvir. As a conclusion, we can say that some gradual structural changes were observed in patients treated for hep C since 2016 to 2019. Patients were gradually younger and gradually had less advanced stage of liver fibrosis. The most prevalent genotype was 1b, and most frequently used drugs were at the first year 3D and interferon-involved regimens, and last year lecaprevir and pibrentasvir. But we have to say that structural shift in patients treated for hep C was not as apparent as was originally supposed. Maybe because other centers, which are more targeting on treatment of people who inject drugs, were not included in the study. Let me thank all my colleagues from all centers joining the harm registry, and thank you for your attention.